Hey guys, this is Dr. Hub. Today we'll look at the skull foramina. The skull foramina, as well as we are going to look at the structures which pass through them. Structures passing. So first, we are looking at the optic canal. So under the optic canal, by the end of the video, we'll also show a rough representation diagram. So this optic canal, what it transmits will be the optic nerve. And then it also transmits the optic arteries. So it's very easy to understand. Optic canal transmits the optic vessels, that's the optic nerves, as well as the ophthalmic arteries. Next we look at the superior orbital fissure. Superior orbital fissure, we are writing it as SOF. So what does it transmit? It transmits the lacrimal nerve. So there is a lacrimal nerve. So this will be V1. Then there is also presence of the frontal nerve. The frontal nerve is nothing but V1. Then the nasociliary nerve. The nasociliary nerve is again the V1. Next, we look at the cranial nerves. The CNs will be the 3, 4 as well as 6. Then comes the presence of the superior ophthalmic vein as well as the inferior ophthalmic vein. Next what we have is the foramen rotundum. The FR is known as the foramen rotundum. So this will be the maxillary division of the cranial nerve 5. So foramen rotundum, it will have the maxillary division. So it's the maxillary division of the cranial nerve 5. So it's V2. So what will happen in the foramen ovale? The foramen ovale, it will have a structure male. This is very important. So male. So male M stands for the mandibular division. So it's the mandibular division of the cranial nerve 5. That is the V3. And then we look at the accessory meningeal artery. So the accessory meningeal artery. So accessory meningeal artery, and then L stands for the lesser petrosal. Lesser petrosal nerve. And what is the E? E is for the emissary vein. E is for the emissary vein. Next we look at the foramen spinosum. So in this foramen spinosum, there is going to be the middle meningeal artery. That is the MMA, middle meningeal artery. Next comes the nervus spinosum. This is all in spinosum. So in spinosum, it's very easy to know that it is going to be nervus spinosum, which is going to be passing through it. Then there is a middle meningeal artery as well as a middle meningeal vein. So 3 structures to the spinosum. Next we look at the foramen of lacerum. The foramen of lacerum, it has a deep petrosal nerve. So there is a deep petrosal. There is a deep petrosal nerve. Then there is also a meningeal branch of the ascending pharyngeal artery. There is a meningeal branch. So the meningeal branch of the ascending pharyngeal artery. Next, there is also presence of the emissary vein. There is presence of the emissary vein. So all this are part of the foramen lacerum. Next we are looking at the carotid canal. So the carotid canal, it will include the ICA. ICA stands for the internal carotid artery. So carotid and carotid will have the internal carotid artery. Then also the venous and the sympathetic plexus. So it has a venous as well as a sympathetic plexus, and this will be around the artery. Next we look at the jugular foramen. So under the jugular foramen, there will be the inferior petrosal sinus. There is an inferior petrosal sinus. There is also the meningeal branch of the ascending pharyngeal artery. There is a meningeal branch, and this is of the ascending pharyngeal artery. Next is the CN, the cranial nerve 9 10 as well as 11. Then in the jugular foramen, there is also the sigmoid sinus. We are writing it as SS, and this is continuing as the IJB. Lastly, what is the structure in jugular foramen? It will be the middle meningeal branch of the occipital artery. So middle meningeal branch, and this is of the occipital artery. Next, we look at the hypoglossal canal. So under the hypoglossal canal, what is transmitting? It will be the hypoglossal nerve. So what is under the hypoglossal canal? It will be the hypoglossal nerve. Hypoglossal nerve is nothing but the cranial nerve well. Lastly, we look at the foramen magnum, the main foramen. Foramen magnum, we have the osseo ligamentous, that is the anterior compartment. So let's write it down, osseo ligamentous. Osseo ligamentous is nothing but the anterior compartment. So this osseo ligamentous anterior compartment. So here there is a apical ligament. So what are the structures? There is a presence of the apical ligament and the tip of dens. There is apical ligament as well as the tip of the dens. Next, there is also presence of the upper band of the cruciate ligament. There is an upper band, and this will be of the cruciate ligament. Cruciate ligament. Next, there is also a membrana tectoria. There is going to be a membrana tectoria. So this was about the osseo ligamentous compartment. Next, we look at the neurovascular. So in terms of the neurovascular, under the neurovascular, it is nothing but the posterior compartment. So neurovascular compartment, what are the structures? So the structures, it includes the lower end. There is a lower end, and this is of the medulla. So there is a lower end of the medulla oblongata, and this will be with the meninges. This is with the meninges. Next is the fourth part of the vertebral artery. So the fourth part of the vertebral artery, this is going to be surrounded by the sympathetic plexus of the nerves. So this will be surrounded by the sympathetic plexus of the nerves. Next is the spinal roots of the accessory nerves. There is a spinal root, and this is of the accessory nerves. Next is the anterior and the posterior spinal arteries. The anterior and the posterior spinal arteries, and also there is a tonsil of the cerebellum. This tonsil of the cerebellum. Now let's try to picturize the foraminus. So we are going to look at the prominent structures. So the center, the biggest canal will be this will be the foramen magnum. So the biggest what we see is the foramen magnum, and just beside this there will be a small opening. This will be the hypoglossal canal, and just above this there is going to be, it is slightly bigger than the hypoglossal canal. This will be the jugular foramen. So next, when we go further, there will be a oval structure. As the name suggests, this is nothing but the foramen ovale, and below the foramen ovale, next to it, medially, there is going to be another structure. This is nothing but the foramen lacerum. So medially to the foramen ovale, and below it, it is going to be the foramen lacerum. And below the foramen ovale, here it is the carotid canal. So this will be known as the carotid canal, and laterally to the foramen ovale, there will be a pin-like structure, and this will be known as a foramen spinosum. Foramen spinosum. Then above on then there will be a curve projection. This is nothing but the superior orbital fissure. This is nothing but the superior orbital fissure. So before we start, the view which we are seeing right now is nothing but the superior view. So there will be a superior orbital fissure. So superior orbital fissure, medially to it there will be another foramen. This is known as a foramen rotundum, and this foramen rotundum will be just above the foramen ovale. This is the foramen rotundum. At the medial most, we will have the presence of the optic canal. There will be a optic canal, and this optic canal will be above the and medial of the superior orbital fissure. Similarly, we will see it in the same order in case of the inferior view.